This video is about how to do self-myofascial release for back pain. A lot of people do self-myofascial release on areas of their body that are the areas that hurt, which sometimes can be helpful. In the case of the low back, it's primarily in the legs, usually, and the hips. So what does that look like? There's two different types of postural patterns that contribute to low back pain, especially chronic low back pain. Those patterns are either a pelvis that has a posterior rotation. So posterior rotation means your back is flat, means that your pelvis is tucked like this. Back is flat. This is a shortening of the hamstrings. This can involve some glute tension also, and this usually involves the hip and the IT band. The other position is an anterior rotation where your back is very arched. Sometimes the belly sticks out for this position, and what causes the back to arch is the quadriceps muscle. So the quadriceps is pulling it forward. Deep hip flexors are tight, including the psoas. These are the two common patterns. Both involve the IT band and the hip, but on one you're going to focus on the front, and on one you're going to focus on the back. For a posterior rotation of the pelvis, where your back is hypermobile, we want to do hamstring work. So the work on the hamstrings is I'm going to just start this guy. It's pretty much fully closed. I'm going to start it with the top tilted in, and then I'm going to set my hamstring on it. And then I'm just going to rest. So I can put a little bit more weight into it with my elbow. If I can lean forward here on my elbow, that increases the pressure. Another way to increase the pressure is to cross the leg over if you have that flexibility. I could also put the elbow on it. Right now that increased the pressure quite a bit, and all I'm doing is sitting here. I have my hand on the ground back here. I can also push from that arm. But basically the principle of any self-myofascial release is that you want to be centering your weight over the device so that you don't have to work super hard to do it, you know? There's other devices where you have to use your arms or whatever, like you have to work. What I want you to be thinking about here is that it's just about getting our weight over the device. So I can move that up and down the hamstring. If I'm closer to the butt, that's the attachment point, the upper attachment point. This feels great. Or I'm lower down toward the knee. You don't want to be right behind the knee. This thing called the popliteal fossa is not great, the knee pit, if you will, but right above it is awesome. And the thing about this roller is you can also work on the sides of the popliteal fossa. That is where the actual connections of the hamstring connect to below the knee. So this thing, you see there's this space here. That's where that popliteal fossa is. Don't want to be working on it, but you can be working on the sides on either side. This works great. So you're just going to explore your hamstring and figure out where the most tender spot is. We're looking for like a nice dull ache, and you want to sit there. In order for fascia to change, we want to be there for about up to 90 seconds, at least 20 seconds on a spot. So one of the other good reasons for getting your weight over the device is so that you can just hang out and notice your breathing. You want to take deep breaths while you're taking this pause, trying to focus on consciously releasing the tension. The next thing we're going to do is the glutes. So for the glutes, I'm going to separate it a little bit because we want to make room for the sacrum, which is in between the glute muscles. Glute muscles are here. The location of the roller is here. If we make it wider, we start to hit kind of the hips. But we're going to start in that position. So I'm just going to lay on my back with my knees up. I'm going to go into a little bridge pose, and I'm going to sit on the device. Same principle. All I'm doing is relaxing, noticing my breathing. I can bring this leg up and over, intensifying. If I want the most intense, I have my legs up or my legs in the air. These are all more intense. That's more weight over the device. And again, just sit here. I can roll my butt up or down it, find a good spot, look for that like little area where there's tension, and then you're just gonna hang out. Sometimes you can wiggle on this thing. That feels nice. I can like turn my hip and put my weight over it. Now I'm mostly on this side because my knees are again cantilevered over the area where I want to put weight down. I can do it on the other side. That feels great. I can do like circles if I want to. Oh, and then that is such a sore spot. I just want to sit here. I don't want to do anything. Notice the breathing. 20 seconds to 90 seconds. The next thing is the hip. So I'm going to close it again, pretty close together. I'm going to put it on either side of the greater trochanter. So that's this bone here. There's this other bone here. and there's a fleshy bit in between here and the flesh along the side of the leg. This is where we're targeting, so I'm going to start up at the hip. Again, I don't want to be on the bone, but I want to be kind of in between the bones where the flesh is. And you can just sit in a spot that feels good, you know, take your time. I'm going to roll up it. Now I am around my IT band. Right now, the rollers they kind of start to wiggle a little bit, which sometimes can be nice, but in this case, it's digging a little bit too directly into my IT band, and I want to be right on the outside of it. So I'm just going to open it up a little bit, and then sit back down on it, and then I'm going to keep my rolling going. And just wherever you feel tension, you know, again, hanging out. If I want to take weight off of the device, I'm going to bring my leg up so I can put some weight into my foot, which reduces the weight, or if I want more weight, I'm going to have my foot on the other leg, which transfers my weight directly into the device. You don't want to put weight directly on your kneecap, but like to the side of it's fine, above it's fine. And those are the main things for a posterior tilted pelvis. Now, when we're dealing with an anterior tilt in the pelvis, that's going to be more quadriceps. If you aren't sure about which is which as far as your posture is concerned, you can just do all the work on your body, and whatever feels like it has the most achy spots or the most tension, that's probably what you got to focus on. So you don't have to necessarily get it right, just be willing to experiment a little bit before you figure out what you need to focus on. So here I'm going to be putting it, again, I'm opening it up so that there's a little bit of space for my thigh. I'm just going to put my weight down. I can move my body up and down the device. I'm just using my hands and kind of like scooting along the ground. Again, more weight over the device with the leg up. I can increase that by doing things like hooking my heel and bringing the opposing knee off the ground. Or I can bring my whole body up off the ground so that I'm using my right arm here. It's hard to see, but I'm using my right arm to put more weight into the device. And I can just kind of roll up and down the device. And if the roller, again, feels like it's out of place, just move it a little bit with your hands. Usually, you know, a ½ inch to a ¼ inch can change something from too painful to feeling good. Now, the next phase of the hip flexors is the iliacus and the psoas. So I'm going to just bring my pants down a little bit, and I'm going to be targeting in here. For the psoas, you want to remember, and iliacus work, you want to be below the belly button and not on this hip crease down here. This is an endangerment zone. We should never be putting pressure on the inguinal ligament. I guess it's like here to here. But right above it is great. So there's the bone right here. The inguinal ligament comes off the lower edge of the bone. So we're just going to be above that hip crease and below the belly button. So I'm going to be here. I'm going to make a little bit of space for my hip. And I'm going to put this guy on either side of my hip bone. That's it. And I breathe. This one, breathing is so important in relaxing. Finding that spot. Ooh. That's a pretty good feeling. And then again, I can lift the leg up if I want, even off the ground. But really, for most people, this is enough. I can lean my body weight. Again, I'm using this arm, putting the hand on the ground, and I'm going to rotate my body weight over. That feels pretty nice. That's putting a little bit more pressure on the outside of the hip. That's the TFL. TFL is also included in the hip flexors and can be a part of this pattern in the body. You can also address the TFL from the side when you're working on the upper part of the hip. Both have a little bit of a different vector and one might be better for you or the other. Again, 20 seconds to 90 seconds. When you're doing work in the abdominal region, I would encourage you to spend a little bit more time breathing and relaxing. Lean into that 90-second time period. There's a lot of layers in the gut. Sometimes there can be emotional stuff, and if you just breathe through it and relax, those layers will melt. Good luck. If you have any questions, just ask me in the comments. I'm happy to help. Thanks.